Good afternoon. I'm Sharon with Nurse Tim, and I'd like to welcome you to our webinar, Alternate Format and Next Gen Test Items, Clinical Judgment Matters, featuring Karen Sherrill. We will have technical assistance available at 866-861-2896, option 1, or help at nursetim.com. Handouts are available to download for our live viewers in your login email and for archive viewers on the right side of your screen. Please note, handouts are for personal use only and not to be distributed to others. On the Zoom toolbar, you'll find the Q&A pod usable by our live attendees. At the end of our webinar, we look forward to a discussion with your questions in the Q&A pod. Our archive listeners are encouraged to drop us an email or give us a call. We also value your input as to desired topics for future webinars. ANCC disclosures. Conflict of interest. This educational activities planners and the presenter have indicated they have no bias or conflict of interest. Successful completion. Criteria for judging successful completion of the webinar are attendance at the entire activity and submission of a completed evaluation tool. NCPD. This workshop has been awarded one contact hour by NurseTim Incorporated. NurseTim Inc. is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. For more information, contact help at nursetim.com. Objectives. 1. Define clinical judgment and discuss its use in developing test items. 2. Compare a variety of high-level alternate exam item styles. 3. Develop alternate format test items to reflect clinical practice. Purpose. The purpose of the webinar is to assist faculty in developing alternate format test items and exams which will improve students' clinical judgment and prepare students for success on the NCLEX RN and NCLEX PN exams. Throughout this activity, the speaker may use a variety of real and varied resources from health education vendors. They are for illustrative purposes and are not to endorse any product. All images and references to the NCSBN Next Generation NCLEX are the property of the National Council State Boards of Nursing and provided for teaching purposes only. And now I am pleased to introduce our speaker. Karen Sherrill is an experienced nurse educator with over 20 years of teaching experiences at Marcopia Community Colleges in Arizona. During her teaching tenure, she has been involved with multiple projects, including online education, informatics development, active teaching strategies, new grad transition to practice, and the integration of classroom lab and simulation technologies. She teaches third trimester nursing students in the classroom and simulation lab, along with facilitating student success courses throughout the curriculum. Karen's full bio is available on the nursetim.com team page. We are so thrilled to have you with us today, Karen.
Thank you, Sharon. I appreciate your warm introduction, and I welcome all of our guests in attendance today, as well as those that are listening via archive. I realize how very difficult it is to carve out an hour of time. It seems like so difficult to find an hour of time. So I really applaud you in taking the time and effort to join us here today. I'm going to go ahead and get the control of the screen here for us to get started. So it was interesting in putting this presentation together. You know how sometimes you start your legwork or putting something together, and then you kind of end up going down kind of a rabbit hole and finding and exploring some other things. Well, during this process, I came across some great information, which I found so fascinating that I continued to research it and decided to share with you some of the things that I learned through this process, because it was things that if I ever heard it before, I had completely forgotten it. So as we're living in this day and age of transition towards next gen, I was kind of curious as to where this whole NCLEX thing has come from. You know, we know where it's headed. Where has it come from? So as you look at the history of the NCLEX exam, the first time that nursing students had to take a nationally recognized exam was actually back in the 30s and 40s. And at that time, they created some what they called objective-based testing. And it was 100% essay. Can you even imagine having to evaluate essay exams on students' ability to understand information? Well, they obviously recognize that this is not the smartest way of working, so let's advance this a little bit. And then during the 1940s and 50s, they did some nationally known exams that were multiple choice in format, but they started out with what I consider kind of overkill. And it probably didn't take them too long to figure that out, because in 1944, when they introduced this first school exam process, the exam actually consisted of 13 different tests. And I'm going to read those off to you what those different tests were. And I look at this thinking, oh my gosh, I'm so thankful I was not a student at that time and had to take all these tests. But second of all, I'm glad I wasn't an instructor that had to make sure my students were proficient and able to take this test. So the 13 exams that were required at that time of a nursing student included anatomy and physiology, chemistry, microbiology, nutrition and diet therapy, pharmacology and therapeutics, nursing arts, which I'm very curious as to what that exactly was, but couldn't find more detailed information on it, communicable disease nursing, which we might think about bringing back in today's education for sure, making sure that's a more solid foundation. It also included medical nursing, nursing of children, obstetric and gynecologic nursing, psychiatric nursing, surgical nursing, and social foundations of nursing. Wow, is what I thought when I read that big list. This was in 1944. And it didn't take them too many years to realize that maybe this was a little bit of overkill. So there was a revision that was made in 1949, and they scaled it down to just 6 subject test exams: medical, surgical, OB, communicable disease, psychiatric, and nursing of children or pediatrics. And by 1950, all 48 United States had in fact adopted this as their licensure test. Well, as we migrated into the 1950s and 1955, the ANA took over the 4-part exam. And again, my jaw drops when I see this, but that exam consisted of 4 parts, and it was 720 items. So they did 600 actual scored items and 120 of the pilot items. And that obviously was in place for quite a while, because the next big change didn't happen until 1978. And at that time, National Council, NCSCN, formed just to establish safety with patient care, which is their motto, and to really come up with some nationally normed, well-scored, high, valid, reliable items that we could be placing on the NCLEX exam. The NCLEX title was given at that time. They reduced that test down to 370 items. So 300 that were scored and 70 that were piloted items. And that was also the time at which the practice analysis was started and completed. So it really created that blueprint that we work from today, just creating that solid foundation of each of those patient care areas so that we know exactly how to blueprint that test and how it's designed, how it's built, and what it's built upon. So it very much science-driven decisions are made into putting that test together. 1994 was when computer adaptive testing came into play. And of course, we know that computer adaptive testing is that students will get a more difficult question depending on how it is they answered the previous question. And it really gave the ability for us to identify pretty quickly in this exam which students were completing the correct questions correctly or incorrectly based on a certain score rate. And it could allow students to take less number of questions rather than taking a full-length exam at that time. So I'm sure you've all gone in to look at this timeline and you said, okay, well, I graduated right about there, and which type of test it is that you took. So a little bit of a step back in history for us. So this kind of brings us to what we're looking at today. And the more recent changes that we have seen actually have to do with the alternate format item. So knowing that the computer adaptive testing took place in the 1990s, when is it you think that National Council and the NCLEX exam began to include the alternate format item. So there's a poll in front of you. I encourage you to go ahead and click on which of these 4 answers you think is correct. Do you think alternate format items were placed on the NCLEX exam in 1998, 2003, 2011, or 2016? And I'll give you the ability to give you a second to vote on which of those 4 you think the answer is. Okay. Sharon, take a look at that, and when you can start to see those coming in, what did we come up with? So it looks like 50% of you think that it was 2011, and the correct answer for us that have been in education for a while, the correct answer is that alternate format items were placed on the NCLEX exam in 2003. Believe it or not, that was almost 20 years ago. And the reason I find that so interesting is because when I talk to schools across the nation, oftentimes I find there's a fairly low number of faculty that are still able to write good, solid application level alternative format items. And that's part of the things that we're going to be talking about today as we migrate through this webinar.
So let's take a look at the alternative formats that were introduced in 2003. National Council identified 6 main alternate formats that were released initially. The first one, the audio item format. Second, the chart exhibit, graphic options, hotspots, multiple response, and fill in the blank. So one thing that was unique about the audio item format is that although that was introduced initially as one of the item formats, it's probably been one that has been least utilized. There were a lot of glitches, a lot of problems that occurred because testing centers didn't have earbuds or audio capability. So it's not one that was real popular initially, and it's taken a few years for it to come into focus with some of the other formats that are used. The others, you know, the chart exhibit format, that of course is looking at a piece of an electronic health record and identifying various components of it. Graphic options, which would give us some visual images. Hotspot items, typically, again, that was clicking on a location of an image. Multiple response, our all-time favorite, select all that apply. We all love them, students all love them, and I'm joking, of course. We don't like these items and our students hate them as well. The challenge we have is that they have a very low rate of success for students for a variety of reasons. Fill in the blank test items are those math calculations, medication calculations, where the student enters a number. How has this evolved and changed? What has happened since 2003? Well, not a lot. There has not been a lot of change that's occurred since that time. The only additional item style that we see now is the drag and drop or ordered response type item, which is using a sequencing of events in order to put various steps in order. So you should have seen this document by now. If you have not, I encourage you to go to the website listed at the bottom of the image. This is the clinical judgment measurement model as introduced by National Council. And this is really the focus and reason for next gen items, what they're being built upon. The component of this, layer 3, which is going to be measured within all different types of next gen item style types, has 6 different components within it. So through the process of next gen style items, National Council is able to measure the student's ability to apply each of these concepts, each of these 6 ideas. Just below that in layer 4 is what we call the environmental and the individual factor types. And those are kind of what I like to call with students, I call them the curveballs, or they're the components that add context and realism to a test question or to a situation. So it might be maybe a nurse that is working under the pressure of a timeline, or maybe a patient that has become more sick or become more critical, or there's been an environmental change. Those are components that really have been shown through National Council's study and research to show that these nurses make decisions in a different way when they have these different factors placed upon them in the middle of their clinical judgment decision making. I like to use the comparison. You know, I think back to the days I worked in the intensive care unit. Give me any ICU patient rolling the door, I can handle it. I can take care of them. I've got it. I'm all over it. Clinical judgment, not a problem. But the day that I pulled the short straw and I got floated down to labor and delivery unit, I could no longer make clinical judgment decisions about patient care because the environment was different. The task complexity was different. The skill set was different. My knowledge base was different. My level of experience was different. And it truly impacted my inability to make sound clinical judgment decisions when placed in that situation. So what happened next is National Council looked at these different test items. They looked at the current style of items that we have for alternate level items, and they compared those to those 6 components of layer 3 of the clinical judgment measurement model. And they highlighted them as either green, as in really measures that area well, yellow kind of measures that particular area, or red doesn't measure them at all. So on the left-hand side, if you take the example of drag and drop item, again, that's where we're sequencing events, having our students place some decisions into a correct sequential order. Those style of items did a so-so job when it came to recognizing and analyzing cues, but they were completely ineffective in having a student prioritize hypothesis, generate solutions, take action, and evaluate outcomes. So from this study, National Council said, hey, guess what? The items we're currently using for alternate format really are not measuring the process of clinical judgment. We've done our research, we've done our studies, we've recognized, identified, and defined clinical judgment, but we don't have test items that are measuring that in our newly graduated students. So the next step and what's going to be moving forward with next gen item formats in 2023, we have 6 different style of items that are currently being introduced by National Council. The close item, which operates through a drop-down menu where a student is completing a sentence and they have basically fill in the blank boxes. They get to choose from a list of options and they have to complete a sentence. An enhanced hotspot or highlighting, the old-fashioned hotspot, where I had a graphic image and I clicked on that box or that location, is now evolved and advanced to the point of looking at an electronic health record. So a student may be clicking on some particular vital signs in a vital sign trend table, or they may be clicking on some keywords in a nursing note that identify priority actions that a nurse needs to address. So they might be recognizing cues and prioritizing hypotheses by highlighting particular portions of an electronic health record. An extended drag and drop is much more complex than the traditional drag and drop, where it has more levels of decisions that have to be made and not a single choice that needs to be made about a single topic or point in time. The other piece that's included in this is what they're calling the bow tie, which is basically a drag and drop that looks kind of in the shape of a bow tie, but it has students making a multitude of decisions. In some cases, it can be as many as 7 different items that have to be dragged and dropped into different formats and columns of material and information. The bow tie from National Council standpoint is one of the 2 standalone items, which means it measures multiple facets of that layer 3 of the clinical judgment measurement model, and therefore it can be a standalone item and not in collaboration with a total of 6 items, which is what you find in a case study item. The extended multiple response is, that's a select all that apply on steroids. That is a select all that apply with up to 10 answer choices. There will be times that the student will simply choose any of the 10 items that apply, and there will be times the student will be told exactly how many answers to select. They're calling those the select N. So a student might have 10 different options in the select all that apply list, but they're being told in the question to only select 4 of those. And so that's what we're seeing as far as changes with the multiple response items. Grid and matrix items is kind of a table format where students are selecting 1 or more items from a particular row of information. So you might have actions, what actions are appropriate, what assessments are appropriate, what's the hypothesis of what's going on, and the students will click within these different components of the grid or box in order to make those determinations. Trend, like I said, is the other type of a standalone item. and it's going to show the student trends and data that they have to analyze and make the best decisions for. So what happened after National Council created these different style of items? They went back and compared those to the decision-making process of clinical judgment. And as you can see, they came out with a much different outcome. The green areas are ways in which that item style identifies and addresses that area of the layer 3 component. Lots more green in these options. So therefore, it was a pretty sound decision to say, guess what? We're going to go with this new style of test item because it really is measuring a nurse's ability to make sound clinical judgment decisions. So the next process we want to look into, and this is really so important, how do we take that basic knowledge and move that towards clinical judgment in our test items, in our activities we have in the classroom? How do we increase the intensity and so that we can get our students to that level of where they need to be at? And it really is as simple as, I say that very cautiously, moving a student from knowledge to application. How do we take a knowledge level item and move it to an application level item? Now, we've talked about this forever in our regular multiple choice questions, but how do we take and identify a knowledge level alternate item, and how do we build that into an application? So I'm going to show you several examples. What does a knowledge level alternate item look like, and what does an application level alternate item look like? So the first component is when you're talking about an audio item. You know, an audio item is one of those that a student is going to receive on NextGen. And when you look at an audio related to the knowledge level, question comes up, how should the nurse record this sound in the electronic health record? I'm going to very quickly share my sound with you, and I'm going to go ahead and play this audio clip. If you listen to this sound with your students, how would you record this? So after your students listen to that audio sound, they are simply going to record what that sound is in the electronic health record. That is the process of applying their knowledge. They have a knowledge of what that audio sounds like, and they are able to tell you what it is. What is that sound? That's a simple, basic knowledge level item. Now, what oftentimes I will have instructors say is, I don't give a lot of audio items because it's really complex and it's difficult to do that in my exams. So here's some suggestions for you. If you have a software program where you have the ability to embed an audio clip or upload an audio clip into a computerized testing program, maybe within your course management system, I encourage you to include that. Know that if you're doing that and you're giving your students the exam all in one location, they have to have earbuds, so they're going to be able to hear that audio play when the time comes. If you've got a classroom of students and you don't want to take the chance of students not having their earbuds or whatever the case may be, you can give all your students an audio question right up front. So they might be sitting at their test and you've handed out their paper exam. Or maybe they're on the computer and question number 1 that comes up for them is an audio question. So you can guide the whole class as a whole, and you can say, okay, everybody, the first question is an audio question. I am going to play this audio clip 3 times on the computer, and after you're done listening to the audio, then I want you to go in and answer question 1 to the best of your ability. You simply play it on the speakers in the room, you play it 3 times, then you close it down and let your students open their test booklet or go to their online exam and answer question number 1. So what does that question look like if it's a higher level application item? And to put an audio question into that type of context, we want to give a report. This is an example of a way in which to do it. So I'm going to, in fact, give an audio handoff report to my students and have them identify which client the nurse should assess first. So I'm going to give you just a brief introduction to this patient in the audio clip. because the actual recording is about 4 or 5 minutes, but this is a fun one I like to use in my class because it really pushes students to better understand the process of prioritization and which patient they should see first. So let me go ahead and play this. Hi, this is Karen, and I'm giving you a report on patients today in our skilled care facility. The first patient that you're going to be taking care of today, her name is Molly Bates. She is 72 years old. She is new to our skilled care facility. She just came in yesterday. She had quite an extended stay in the hospital before she came to us, where she had a fracture, fell and had a fracture a few weeks ago at home, and ended up going to surgery for her fracture of her leg, her thigh actually, and had an extended hospital stay because she got secondary infection. She has now come to us and will be continuing to stay in our facility. So you get the idea with that. And what this audio would go on to do is give 3 additional patients besides this patient here. And students would then have to make the decisions about how to prioritize which patient they're going to hear or see first, which one they need to assess first. So as you are creating that audio, oftentimes that prioritization process, we might give it to our students in a written format. That's great. We might give it into an audio format where we're actually speaking the report and giving them an actual report in the classroom. That's great too. But I can also do a pre-recorded report. And as I have used these different formats in class, first of all, I see pros and cons to all of them, and that's the reason why I like the variety. When you give students a written report, it's not realistic. What they're hearing at the bedside in the agencies is a handoff verbal report. So it's important for them to grow their auditory processes and not just their visual reading processes. And once again, we're addressing different styles of learning and understanding in our students, and we want to address as many of those as we can. So shaking it up and giving them a verbal report is a great skill for them to grow and learn. Now, why would I do a recorded report versus an actual verbal report that I'm reading to the class? Well, here's the thing. If I give a handoff report in class as maybe an introduction to an assignment or a case study, my students are diligently writing the information down, and then they always have questions. And many times their questions are, now, did you say that IV is in the left arm or is it in the right arm? And they'll say, did you check a urine output or a potassium level? They'll ask all these questions and I will feed them the information. I'm not sure feeding them the information is always the best. I want them to use clinical judgment and think about what else they need to be acquiring, what additional data do they need to be collecting in order to effectively care for the patient. When you give them a pre-recorded audio report, they don't ask you questions because it's almost like a third person is giving that report, and they don't feel they can ask you the questions because you're not giving them the report. And it's a little bit sneaky, but I found it to be very effective in having them in their own minds going, okay, I need to assess and find out which arm the IV's in. And okay, I need to assess to find out what their urine output is. And I need to think about what their potassium level is going to be. It starts this internal dialogue of additional questions to ask. And that is the thinking. So what's the next type of question? Drag and drop ordered response. When we look at that lower level, knowledge level items, we are talking about usually skills. Okay, put the steps in order to deliver an IV push medication. Drag and drop the steps in the proper order. Low level, knowledge foundation, alternate item. Why is this not appropriate for my thinking students? Is because this is just memorization of the checklist that they learned in the lab, and it is not a practical application of information at the patient's bedside. So what does application look like in a drag and drop question? In which order should the nurse perform each action for a client who's dizzy while walking in the hallway? Okay, I've now given them a clinical situation where they need to make decisions about the care of the patient. I've taken this drag and drop type of item and put that into a higher application level. I could mix it up a little bit. I could maybe include a blood pressure in the question itself. I could do a video, a short video of a patient who's walking down the hallway and looks lightheaded and dizzy. And what are you going to do? There's a variety of ways in which you can present this, but again, it's creating that clinical focus and decisions at the bedside. Chart exhibit. I love chart exhibit items. I don't know what it is about them, but I love the way that students analyze and really have to think deeply about the information in front of them. This is a real simple knowledge based. Which vital sign in the flow sheet is most important to monitor for hypotension? Well, all my student needs to know to answer that correctly is that blood pressure and hypotension are related. It's a real simple, basic knowledge level item. How do I get this to a higher level type of alternate item? Client reports chest pain at 4:22 in the afternoon. What action should the nurse take? So now not only am I analyzing a series and sequence of vital signs, but I'm also giving an abnormal event, physical event that's occurring during that vital sign trend. So students need to look at this information to determine what steps the nurse needs to take given this particular scenario. The other thing that, if you can see this slide, I realize it's kind of slow, or it's kind of small, but if you look at the vital signs at 4:22 in the afternoon, that blood pressure is 100/59 and the heart rate is 108. Now, if I'm teaching cardiac and I'm thinking about the delivery of nitroglycerin, of course, and oxygen and all the other things that we do, but I want to give those numbers being borderline numbers so that that student can make a really wise decision and clinical judgment on how am I going to be treating this chest pain when I have borderline vital signs. Now, if I had a great blood pressure, strong blood pressure, or a really low blood pressure, it makes it easy for the student to make that decision. But as your students progress in the program, you want to give more information that's like right on the edge of which direction do I turn in order to safely take care of this patient. So they're making these kind of important decisions similar to what they are going to be seeing in clinical. Graphic, the examples of graphic in the current alternative format by National Council is an image for an answer choice. So a knowledge level basic would be in which image represents Fowler's positioning. And it's simply, does the student know the information? It is totally knowledge. How do I escalate that to a higher level? Well, let's do some observation of some patient assessments and what observation requires an action by the nurse. I look at these 4 images. There's probably 2 of those actually that I would do something about. But do the students recognize that, or should I make this into a select all that apply? But again, this is a nurse making a decision at the bedside. Hotspot, low level knowledge. Select the location of the apical pulse, okay? That is an old-fashioned hotspot item. I bet I've seen it in a million different test banks. You see this one all the time. Low-level basic knowledge hotspot item. How do I make a hotspot higher level application? Well, let me give them a picture of a patient's room and ask the question, where should the nurse place the overbed table for a client with left hemispheric oh my gosh, that word's not going to come out. Hemisphere, oh my gosh, I'm skipping it, guys. You can read. Okay. For a client with a left stroke. All right. So when I look at this image, this is again the decision that a nurse is going to be making every day. Okay. I'm thinking, okay, right hemisphere, left hemisphere, which side is the paralysis on? What side do I need to put the table on? That's nursing point of care decision making right there. And that's going to escalate this hotspot to a higher level of application. Multiple response, of course, those are our SATA questions. Think about how to escalate those into the decision making process. Nurse discharging a client newly diagnosed with diabetes. You can find that answer on a textbook page because we all have those big blue boxes in our textbooks that tell the student exactly what they need to be teaching a patient with diabetes upon discharge. That's going to be a knowledge level item. Whereas if I want that student to really apply clinical judgment, I want them to compare different clients that have teaching and identify who has the greatest amount of teaching need. So maybe it's going to be a patient who has discharge medications that are new. Okay, that's pretty simple teaching. Or the next one's going to be a client who has a significant wound care that they need to learn how to take care of themselves upon discharge. That's going to be a patient that requires a large amount of teaching. So this would allow that nurse to prioritize their day and to organize their day so that they can properly spend the correct amount of time and as much time as possible with a variety of different patients, depending on their teaching needs. Multiple response, another example. Client's dehydrated. What assessments will the nurse find? Again, A, B, C, D, straight out of the textbooks. But the client assessment shows dehydration. What action should the nurse take? So this is a question of what's the nurse going to do about it. It's going to apply a higher level of understanding, and it might include answer options such as lower the head of the bed, increase the IV fluids, on and on and on. So how do we take those types of alternate items that we have available to us or that we're currently using and migrate those towards a next-gen item? Well, the thing that you want to do is think about how to take that information and build out a patient case in an EHR. If you take the nursing notes, the vital sign graphic, the history and physical, lab and diagnostic, the MARS, whatever, you want to build those out and put a patient's case into the EHR. That's going to be your first step in building those next gen items. After I'm able to do that, I want to present it as an unfolding case. So when we talk and hear from National Council, what they're telling us is that students are going to be exposed to at least 3 cases of next gen items, and each case will have 6 questions within it. So it's going to be an unfolding case over a series of 6 questions. I should say that's what they're telling us today. Always check back at their website for the most recent information. Then I want that student to apply higher thinking questions as they migrate through that material. So I'm going to think about, does this question allow the student to recognize cues? Does this question allow the student to prioritize hypothesis? Does this question allow the student to generate solutions? I want to think about each of those 6 items in layer 3 of the clinical judgment measurement model to make sure that I'm assessing those in my students. Constantly unfolding new parts and pieces of information with the more pages of EHR that they open up. So how do we take this next gen close item? What does that look like? So I've now created a patient on the left-hand side of the page. I've started with that patient banner. I've got in there some key pieces of information. Allergies is right there, which is always good to know. My age, I've got the BMI, I've got some basic information for my patient. And then I start to create a nursing note. And this one unfolds with 2 separate entries. I've got a 10-10 entry and I've got a 10-20 entry. So I'm seeing a progression of events, a progression of assessment findings. I'm starting to build a story about this patient, Alfredo Hernandez, as he comes into the emergency department. I'm also going to give my students a snapshot of those admission labs. What do those labs look like? I'm not going to tell them what's important and what's not important. That's what they have to determine on their own. So a close item on the right-hand side is the client is experiencing blank as evidenced by blank. So drop-down 1 would have the 5 options in drop-down 1 option table column below it, and drop-down 2 would have the right-hand column included. What will this do for my student? My student has to analyze that data. They have to recognize cues. And they have to start to prioritize hypothesis of what's happening with my patient based on the information that I have. So it's taken me some time to build these different chart parts. There's no question about it. But what you do is you take these chart parts built out in, say, a Word document, and you replicate them, make a few tweaks and changes, and you can use them on another patient. Same goes for your next gen item that's on the right-hand side. If you look at this drop-down question that I wrote, clients experiencing blank as evidenced by blank, that is a great prioritize hypothesis question. And what I'm doing is I can now replicate this for a scenario for a patient with pneumonia, kidney failure, heart failure, liver failure, and COPD. Because the same question will work for any of those patients. All I need to do is change out the EHR components. To the left, I've got a brand new next-gen question. When we do that, we are now going from right on up the Bloom's taxonomy scale. When you've got the next-gen item in place, you're moving from application analysis, high-level items. We are now at synthesize and evaluate. That's the process of thinking that needs to take place in order for our students to answer these style of items. Hotspot highlighting. Like I said before, that has to do with highlighting a component of electronic health record. Again, I've got parts and pieces of that same EHR on the same patient. After reviewing the client information, click to highlight the findings that are most concerning. So I've now started, again, I'm starting to prioritize my greatest concerns. I'm analyzing the cues, and that's the process my student is going to go through by clicking on these different parts and pieces. This is an example of a drop-down or bow tie, more specifically. EHR on the left-hand side once again, and you see from this bow tie design on the right-hand side, students have to drag and drop words into these 7 different boxes using the table below it. So I'm going to select 3 of those findings in the list, and I'm going to drag those up to the box that I want them to be in. I want to identify the condition, and I want to recognize the action that the nurse will take. You can see how these bow tie style of drag and drop items are standalone because they're really requiring that student to function at several different pieces of that layer 3 of the clinical judgment measurement model. I am recognizing cues, I'm analyzing cues, I'm prioritizing hypothesis. I am doing all of those things. I'm generating solutions, I'm taking action, I'm doing all of those things. And that's the reason why these bow ties are going to be considered standalone items. Multiple response, like I said before, these are our select all that apply on steroids. So this is an example of 10 different select all options. This one does not give me a select n, so it does not tell me how many choices to make. It just says that my student can select as many or as few as they choose based upon the information given. This is a grid matrix, and when you have a grid matrix, you're going to have a table with columns as well as rows. And for this example, there's actions in the left-hand column, and the student has to prioritize each of these in the order that they want to perform them. So after I've reviewed patient information, I'm going to determine the sequence the nurse should perform each action. So I'm going to select one option for chest x-ray, one option for deliver the diuretic, and the students will put those into sequential order of how they're going to perform those. Trend item, again, trends and data. So not only do I have a single vital sign record, but I have 3 different sets of vital signs. Not only do I have a single nursing note, but I have 2 different nursing note entries. And this is going to have my student looking at lots of cumulative long-term data and identifying some priority concerns based on that. Trend in information and material is something we need to be teaching our students from day 1 of nursing school. They don't have this skill set. As was said earlier, I teach 3rd semester. I'm shocked how often I'll say, oh, no, we're not looking at today's labs. We're looking at the last week's worth of labs. And you're going to tell me what's happened to this patient in the last 7 days of their hospital stay. It is a game changer for many students because they don't realize there was a time before today's shift. And it's important for them to see those trends in data because it makes a significantly different decision as to how they're going to care for this patient in the future. So the last component, let's think about how to build the steps for next gen items. And I look at these components kind of like building a house. You got to start on that very first foundation. Make sure that your items are grounded in foundation. And what that means is that our test items need to be based on student outcomes. As we think about that second floor, this is the point at which we're starting to build that client. So build the client into the EHR format so that they look like a clinical patient in the hospital. That third floor is where we start to apply that clinical judgment piece. What is it that we're trying to measure in that EHR to provide our next gen question? And the next gen questions, of course, is the roof. That's the top layer that we're putting forward. So what is that first floor? I need to make sure every question I write for my students that are being tested on, I need to make sure it's connected to a course and or a unit objective. That's the only way I'm creating a fair exam, is if my test question is based upon an objective of the course or the unit, because that then tells me that I am measuring what it is this course is supposed to be teaching our students. You can also use that process of blueprinting. Start blueprinting your next gen items now. What is the connected concept? What is the connected exemplar? Think about putting into those first steps about which step of the clinical judgment measurement model is this question going to be addressing. Think about what step of Bloom's taxonomy is this question going to be leveled at. Think about, where does this fall into my essentials? Where does this fall into the NCLEX test blueprint? Think about ways in which to blueprint those items right from the very start. We also want to make sure that it's appropriately leveled for the student group. So is this an appropriate question for the experience that this group of students has? Second floor is where I'm going to start to build my client. And don't feel like you need to start with a blank slate on this. Use some examples that are already out there. There's lots of existing case studies out there. There are cases, clinical cases within your textbooks. Those are great for giving you a starting off point for starting to build these patients in the EHR. Think about your personal experiences. And when I think of personal, I think of what experiences you've had in real life. In the cases I've written over the years and that are in some of my books, you are seeing examples of my dad with Parkinson's. You're seeing examples of my mom with a stroke and my son with an appendicitis. You are seeing those cases because those are my personal experiences that I'm sharing through these patients that I'm building and developing. Think of your clinical experiences and your students' clinical experiences. The easiest time to write a next gen item is directly after clinical that day. You're going to be able to sit down, think about all those patients that your students were taking care of, and you're going to be able to build a next gen item from that. Simulation cases. Who are you using in sim? Turn them into a case. How about that patient? That's that one patient that we took care of, and we'll never forget. For whatever reason, you'll never forget taking care of that one patient. Those make some great cases for next gen items. That third floor, how do we go about applying clinical judgment? The best way that I found in which to do that is through these 6 cards that are provided to us by National Council. If you use the link at the bottom of this page, it will take you to one of their newsletters that they sent out in winter of 2019. And what they did with that is they have these cards, and I simply took screenshots of them and I use them as posters and I place them in my classroom and I give them out to students. But what this does is it gives you specific questions for what it is you're trying to measure. So for example, if I want to develop a question that talks about analyzing cues, I can pull out the card on analyzing cues on the left-hand side, and I can ask the question, what client conditions are consistent with these cues? And now I can build a next gen item based on that. If I want to recognize a take action, I can ask the students a question, which intervention or combination of interventions is most appropriate? And I can build a next gen question from that. So this is a great resource for you. I encourage you to use them often. I have a stack right at my desk and I'm looking in on them all the time as I'm putting next gen items together. So what does that final step look like? Well, that's really building those next gen items, recognizing these 6 different styles that next gen has introduced to us, and building out the different types of items that are available. So that's all that I have for today. I would encourage you to go ahead and type into the Q&A session section, and we will go ahead and address some questions. Thanks.
So I do see one question. Paula's asking, she said she found it very hard to make next gen fundamental level items. Yes. So next gen on fundamental, here's the thing, is that even though an item, a student is at the fundamental level, you still need to think about their application of knowledge and not just their measurement of knowledge. So for example, I would love to see a next gen item that had to do with a client who has just been taught maybe how to use a walker and has to navigate up some stairs, okay? So you would build into your EHR maybe a nurse teaching that patient how to use the walker, and then have some of your next gen items be what are some cues or concerns. So maybe the patient says, my bedroom's on the second floor of the house, or something like that. Think about, not only do we measure their knowledge of what is a walker, how do we use it, or where should the hand placement be on a walker, but think about how to put that into that application layout of, now I'm teaching the patient to use a walker. Or maybe I'm walking the patient in the hallway and I need to critique whether or not they're effectively using the walker and what needs to be retaught on that patient. Think about things related to urinary incontinence, things related to constipation, things, I'm thinking of other fundamental content areas, basic med pass. You know, instead of just having the nurse deliver that pill, have the nurse drop that pill on the floor. You know, does the student then recognize how it is that they should handle a situation like that? So those are a few suggestions just coming to my mind right away, Paula, but anyway, other questions? Feel free to type those into the chat. So Julie is asking about learning management systems. That's to build the different types of questions, any software that's already out there. Boy, that is the magical question, Julie. You know, just put out these style of items and the details in the HUD forum last November. So it has not even been a year since our software geniuses have had the beauty of being able to create the software for these. Some companies are moving at a fast pace than others are. I have not seen many learning management systems that are doing it well. And I think part of that is because learning management systems focus on higher education and not on nursing education. So it's not a great use of their resources. The programs that I'm seeing that are doing it well are the ones that have a huge nursing following. So if you think about, of course, I have to say, Nurse Tim, we're doing it well. ATI is doing it. Hearst is doing it. Elsevier is doing it. Publishing companies are doing it. And they're starting to put those software pieces, parts and pieces out there. So it's going to be coming. We just have to be patient with it. So what do we do until that time? Should we use a paper chart? I would say certainly use a paper chart for your classroom. We don't have to necessarily having our students fail because they can't answer next gen questions, but we definitely need to be addressing these in the learning classroom. So I think we're about at the end of our time, and I apologize. I feel like we got shorted a few minutes because of the transition. But what I would encourage you to questions to go ahead and reach out to help@nursing.com. Just put my name in it, just say this question's for Karen. They will get that to me, or you can always email me directly at kcheryl@nursetim.com, and I'd be happy to answer any further questions you have. But I am going to hand over to Sharon, and she can tell you about the evaluation and obtaining your contact hours for today. Thanks so much for coming.
Karen, thank you so much for presenting today. And we'd also like to thank our listeners for joining us today. And now I invite everyone to fill out an evaluation that will produce a contact hour and also your valued feedback, as we do appreciate hearing from our listeners. For our live viewers, a new screen will appear in just a moment. Please click the continue button that will bring you to the short survey evaluation that will produce your NCPD certificate. And for our archive listeners, please click that evaluation link on the right side of your screen. Thank you to everyone for joining us today.